as you're probably aware, we have an ageing population on the Isle of Man. And when you get past that age 65 and older, there's more chance that you could fall. And people of the older age group who have falls often end up with more serious or fatal injuries. And as we have this growing population, we thought it was time to look at our falls provision on the island. Not only look from a hospital point of view, but broader into the community and into the care homes as well.
And what provision is there for fall prevention then?
What we did is we asked a series of questions that were based on NICE guidance to have a look whether we came up to the standards. So we were looking at the provision if someone goes into the hospital, looking at care plans, pathways and general awareness of assessments, environmental, what trip hazards and things like that were around as well, and then extended what provision was there in the community.
Because it isn't a medical condition as such, is something like falls somewhat overlooked, do you think?
I don't think it's overlooked, but I think we as health professionals and the public, etc., need to be more aware of it and making falls everybody's business. Because if you think about it across the whole island, we're looking at possibly, people who are on medication, and that medication may be causing side effects which may produce a fall in a person who's feeling dizzy or something like that. But also look at our environment. Are there trip hazards on the road? Somebody that maybe their balance isn't quite right could easily trip over potholes and different things, pathways and stuff like that. So it's actually looking at the whole provision and how we can make things safer and how we can provide a good service for our island residents.
And what is the next step in doing that?
The next step is that the report's gone to the Department of Health and Social Care and they've had a look at it. And then the hospital and the community senior officers are going to have a look at it, develop an action plan and look how we can improve services.